through a manipulation. As I said, you have a choice whether you want to have it done, and you have a choice whether you want to do it. Okay, it's your choice. Bailins have covered this course, so once you get your piece of paper at the end, you can send it to bailins, and you can add it. You have to add it to their insurance. You can't just, it's got to be their insurance. You have to pay for their insurance. But if you want to manipulate safely, and be insured for what I'm going to show you, then you have to register with them. Yeah, so if you've already got, say, FHT or sports therapy, you'll either have two insurances, or just over time merge to one. Because bailins cover acupuncture as well, whereas other ones might not, that sort of thing. So, okay, let's just go a little higher this way. So just make life a bit easy for you. So using the towel now, we're going to perform a grade 5 manipulation, or perform a HVT. Osteopaths call it the high velocity thrust, and physiotherapists might call it grade 5 manipulation. So let's identify where we are. Common areas of stiffness. Okay, so find your T7. It's going to be around T7 there. So that's a bit stiff in there, and also it's a little bit flat in there. So I'm going to come onto this one. So T7. So I'm going to articulate T6 and T7 is a bit stiff in here. Okay, so it doesn't want to. I can feel in this position he's a bit flexed and it's high on the right, so it's fixed close on the right hand side. Okay, so we're going to try to manipulate that sort of area. Relax that just for a sec. So I know where I am, but I could have maybe kept a star there. Yeah, just for demo. I can just so I know where I am, and it might be an idea for you to do that, so you know exactly where you're going to be sort of like treating. So if I just grab that spine behind you. So let's say, for instance, then I've written these ones. So 6 and 7. I want to manipulate between T6 and T7. What it is I'm going to manipulate is, see the facet joint on the left and the facet. I'm saying that the facet on the right is closed, but this is just a technique where I'll be opening both facets, and actually the stiff side will be cavitating. Yeah. So to encourage the first part, by encouraging flexion, you're already trying to encourage the opening. You see it's gliding? You're already trying to encourage the opening. Because I'm saying that's fixed closed, it becomes a pivoted side. You can see that. So it's going to be in that position there. So the left side is open. Yeah, see the left one? The left is open, but the right is closed. Yeah? And that's why the SP will rotate to the opposite side, but the TP will rotate to the same side. Yeah? Yeah? So it looks fuller on the right and deeper on the left, because it'll go forward. It actually goes forward in that, if you notice, because it'll be a side bend rotation, won't it? Because remember, side bending rotations to the same side, so it's type 2. You happy with that, aren't you?
Yep.
Yeah? Alright, so on that side there. So we're going to try to encourage opening. What we have to try and do is fix the level below, and we articulate T6 off T7. So the towel is going to be used to lock T7. And then I'm going to put the patient into a certain position where I'm going to increase the leverage down to the level but not beyond. Chest to draw, pull, tension. When you feel the tension, that's the lock. When you feel the lock, you perform the technique. So let's just run through some things here. So when you roll the towel, you have to roll it to a point that's really firm. If it's too soft, it'll absorb your effort. When you put a pull, it'll absorb your effort. So using the towel, we place this onto the level below we want to manipulate, onto T7. The sternum is going to come down onto that area just there, like so. And then I'm going to get him to sit a bit taller. Right, his right arm is my preference, okay? It's not, my way is not the only way, okay? It's my preference. Right arm on the left and hold onto the back of your shoulders there. So that's increasing leverage laterally. Okay? Yeah, so you're increasing tension this way. Hand onto his elbow. Now what I'm going to do is I'm going to guide him down to the level, but not past it. So I'm increasing flexion down to that point, but not beyond it. So I don't want to overlock him, I want to lock him down to that level. So I've got some movement at T6 on T7. This hand now, obviously be careful with ladies, etc., goes onto this elbow. Right, look at my left leg. My left leg is pivoting, okay? My right leg is forward, because if I'm in that position and I pull him, I'm going to arch my own back. So the left leg, so I want to keep myself relatively neutral, and the technique from here is I'm going to push with my chest into his sternum, my sternum into his T7. His hands are going to be pulling towards me, okay? So the idea, relax now, the idea is that's T6. The towel pushes T7 anteriorly, and the towels are used, the hand is used to pull T6 posterior. So it's almost like an APPA sort of glide. Yeah, one is going forward, one is coming backwards. The facets now are encouraged to be open, so I'm in that position. and now I'm going to do that movement. And that's the bit I can't teach you. I can set you up, I can show you, yeah, I can guide you, but I can't teach you the last bit. It's really hard about the last bit. It's very, very quick. Professor Hartman, who's a god, if you like, in terms of osteopathy, is the god of osteopathy. He's written books and all the rest of it. And when he teaches manipulation, he says almost like you use your heel of your shoe and have a go. When you're doing a neck, it's almost like it's not that sort of movement, it's more of it's that sort of speed. Yeah? Yeah, so it's high velocity, but the distance is very small. Okay, so it's very, very quick, but very small of a movement. And that's the key, is try and do that. Most of you, unfortunately, when you have a go, you'll either be too aggressive with a pull, you'll either be too slow, yeah, too forceful. It's really hard because naturally we're all different sizes and shapes here. Yeah, but I'm hoping that when you do it, I'll show you. I want to try to do as gentle as I can to show you how easy I can make it look. And unfortunately, if it doesn't click, I might just use a little bit more pressure, but I don't want to. Okay, I'm hoping that I'll give the body the ingredient it wants to go and to cavitate. But let's have a go now. So it's all about the setup. Get them back towards you, yeah, in this position, and be fine. You might want to use something under the knee, like a bolster. The towel, the key is the towel. Roll it so it's really firm. Some people use like 10 black bags. I don't like it, it's too firm. Yeah, so one small towel, no cost really, wherever towel could. Yeah, but I have it quite firm. Ladies, obviously, bits in the way, but you have to work around that. So from there, so place that just below the area. So this is going to fixate T7. Okay. So my sternum is going to come roughly onto that sort of area. His right arm is my preference. Yeah, goes under, and I'm pulling his arms quite firm to lock on the back of his shoulders. Hand on his elbow, head forward to slump him down to that level. This hand on this elbow. Now what I'm going to do now is, I'm almost there, the chest and drawers 3/4 there. To add in that bit of tension, and I'm almost there at the point of bind. I can't just manipulate it from here, I probably could. Yeah, but I want to put in a bit of push in my chest, pull back with his arms. His arms are not being pulled apart, his hands and my chest come together. Breathe in. If I say to him breathe in, and as he breathes out, he knows what's coming, which is fine. Yeah, but some people would naturally tense. Okay, so I sometimes do it by breathing. I let them just, so I watch their breathing, and as I feel they relax, I just do it. Yeah, I have to explain, I have to tell them what I'm going to do. I am going to manipulate to this area. Are you happy for me to do that? So get consent before you do it. Okay, whether you want to write it or just verbally. So once we're in that position, I'm now going to do it. Are you okay for me to do it?
Yes.
Yeah. Okay. So I might say to take a breath in, but you have to watch very close because you might miss it. Take a breath and breathe out, and as I lock him in, thrust. Okay. Relax. What I did then was cavitate only T6 on T7. I didn't get anything below and I didn't get anything above. I only got the joint I wanted to get. I made it look very easy. Yeah. My patient hopefully didn't feel any stress. When I see people do this, I'm not saying you guys and girls are going to be doing it, but when people do it, this is what people do, okay? Arms under, you won't like this. One thing they'll do, hands into the diaphragm, okay? You won't like it. Okay, I guarantee you won't like it. And I didn't do it forcefully, you won't like it. The second thing, you end up, if you're strong and they're small, you'll end up trying to use your strength to lift them up. Just went again, a little bit this way. Yeah. Alright, okay? You'll pull them back, and you hurt your own back. Okay, that's it. Or you'll try to separate the arms. You're like, oh, it's not going. Like that. They won't like it. They won't like any of it. Okay, so you'll either pull your arms apart, you pull your arms down, you pull them up. Yeah, we won't like any of it. Okay? But only like the one I first did. You okay?
Yes, fine.
Yeah. So